This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved. Hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do. This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Hey everyone, welcome to Yeah, We're Going There with Dr. Natalie. I'm Dr. Natalie. Let's just say the quiet part out loud. You could be years past your last period or menstrual cycle, doing great, feeling like yourself again, and then all of a sudden sex starts to burn, peeing starts to burn, you're suddenly getting UTIs like it's your part-time job. Nobody warned you. Your doctor didn't bring it up at your last visit. And you're sitting there thinking, is this just what getting older feels like now? No, it's not. And it has a name. It's incredibly common, and this is the part that makes me the most fired up. It's treatable. Today, we're going there. Genitourinary Syndrome of Menopause, or GSM, is the umbrella term for what happens to your vagina, vulva, and urinary tract when your estrogen levels drop. Here's the simple version. Estrogen is what keeps those tissues thick, moist, elastic, and resilient. It's doing quiet maintenance work down there, your whole reproductive life. But when estrogen drops during menopause, perimenopause, or after something like an oophorectomy, which is a surgical removal of one or both ovaries, that maintenance stops. The tissue gets thinner, drier, less stretchy. Think of it like a well-watered plant that suddenly stops getting watered. It doesn't happen overnight, but it doesn't bounce back on its own either. And I want to be really clear about something. This is different from hot flashes. Hot flashes tend to fade with time. GSM does not. Left untreated, it tends to get worse, not better. Quick note on surgical menopause, because this one matters. If both ovaries are removed, there's an abrupt, immediate stop to hormone production. Not a gradual decline over the years like we see in natural menopause. That means more intense symptoms, faster hot flashes, fatigue, and higher long-term risk for bone loss and cardiovascular issues. If that's your story, please know your experience is going to look different from a friend going through natural menopause. Okay, let's talk numbers. Where a lot of women feel really alone, and you're not. GSM affects somewhere between 27% and 84% of postmenopausal women, depending on the study that you read. And that's a huge range. But here's the number that matters. 40 to 60% of women report moderate to severe symptoms. So let's break down what that looks like. Vaginal dryness. And that affects nearly half to essentially all affected women. Painful intercourse affects roughly 3 in 10 to anywhere between 6 in 10 patients. urinary changes, such as frequency, urgency, and recurrent urinary tract infections, affect a significant chunk of postmenopausal women. So if you've been dealing with this and feeling like you're the only one, you're statistically in the majority, not the minority. This is not rare. It's just rarely talked about. GSM isn't only you're 55 and menopausal thing. A few groups are at higher risk or are at risk of getting it earlier and harder. For example, women who've had both ovaries removed, as we mentioned earlier, they potentially can suffer an earlier onset and often more severe symptoms. Anyone going through cancer treatment, such as pelvic radiation, chemotherapy, or are on estrogen blocking therapies, they'll get hit harder as well. Women who've been on certain hormonal contraceptives, typically oral contraceptives somewhere in their lifetime, that would lower their estrogen can also experience worse symptoms. And finally, smokers. And believe it or not, women who've never had a vaginal childbirth. Smokers and women without a vaginal childbirth are both linked to an earlier onset of symptoms. If any of those apply to you, this conversation is doubly for you. Let's just name the symptoms so you can pattern match your own experience. Vaginal dryness or soreness, burning when you pee, needing to pee more often or more urgently, pain during sex, itching or burning of the vulva or vagina, more frequent UTIs, discomfort during pelvic exam, or even just in certain clothes. And beyond the physical list, GSM affects how you feel about your body. It makes intimacy stressful instead of enjoyable. That emotional layer is real, and it's part of why I wanted to do this episode. Here's something I want you to sit with for a second, because it's bigger than annoying symptoms. There's newer research showing that women prescribed vaginal estrogen within 2 months of having recurrent urinary tract infections saw a real reduction in sepsis, hospital admissions, and mortality. Read that again, or listen to that again. This isn't just about comfort. Untreated GSM and the recurrent UTIs or urinary tract infections that come with it can escalate into serious, even life-threatening infections in some women. That's why I get frustrated when this gets brushed off as just a part of aging, because it's a part of aging you could actually treat. And when you don't, that downstream risk isn't trivial. But this is the good news. You have options, and most women can find real relief. Typically, first-line options are non-hormonal options. Vaginal moisturizers can be used regularly and not just around sex. Of course, there's lubricants that are often used for sex specifically. Definitely ditch the perfumed soaps and harsh products down there. Please, for the love of your microbiome. But there are hormonal options when appropriate, and we're finding that they are becoming more and more appropriate. Low-dose vaginal estrogen, which comes in the form of creams, tablets, or rings, only a small amount reaches the bloodstream, and this can relieve dryness and pain and lower UTI risk. There's also vaginal DHEA. Another term for that would be progesterone. So we know that DHEA is the precursor to estrogen and testosterone. And there's promising research suggesting this may help prevent recurrent urinary tract infections, including in women on aromatase inhibitors, which is what we see when women are being treated for cancer. If you're a breast cancer survivor or have a hormone receptor sensitive history, this is a conversation to have directly with your oncologist. There are non-hormonal options, which are typically tried first, but that's a decision that you have to make together with your care team, not something that you self-diagnose or self-treat. One honest note, for most women, this isn't a use it for a month and you're done situation, and it's crazy how many women don't realize this. Vaginal estrogen and similar treatments are long-term. They are lifelong because if you stop using them, symptoms will return. And that's normal. That's not a failure. That's just how this tissue works. So it's used indefinitely for the rest of your life. I like the analogy of brushing your teeth. If you stop brushing your teeth, you're going to get cavities. So just like that, we need to continuously use vaginal estrogen, if you're able to, forever and ever. Because after menopause, your body stops producing it. If you take one thing into your next appointment, take this list. What's actually causing my symptoms? What are my treatment options? Hormonal or non-hormonal? Is vaginal estrogen safe for me specifically? How do I prevent UTIs going forward? How will I know if it's working? What if the over-the-counter stuff hasn't helped? You are allowed to walk in and ask direct questions. And what's important to realize if you are using vaginal estrogen is that it doesn't fix things overnight. What I've learned is that it can take up to 2 to 3 months to see full benefits. And then again, consistency is key. Women, of course, we're busy. We forget to apply it. So consistency and indefinite use is what's important. And what I want to leave you with in this episode is that GSM is common. It's real. It typically doesn't resolve on its own, and it's one of the most treatable conditions we talk about on this show. You don't have to white knuckle your way through burning, dryness, or other round of antibiotics for a UTI that keeps coming back. If this episode hit home, send it to a friend who's been quietly dealing with this and thinking it's just her. That's kind of what the whole point of this show is about. We say the things that nobody else will. I'm Dr. Natalie, and yeah, we're going there. I'll see you next time. Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there because knowledge drives better health. This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full-spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved, hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do.